Dr. Ricardo Labata da Faria is the Chief Medical Officer and Executive for Emergency Medicine at Seven Oaks General Hospital in Winnipeg.
When we introduced this, we weren't sure what the results were going to be. Very early on, we saw a very positive effect. One of the things that happened is the patients left without being seen number diminished greatly. So people now knew how long the wait was going to be. In the past, they wouldn't have known, was it 10 minutes, was it an hour? Now they knew, and they can make the judgments accordingly. So what we did find is that we halved the amount of patients that were left without being seen. So whenever a patient looks at the board, there are a few indicators they can actually see. They can see how many patients are in the waiting room. They can see what is the average waiting time and essentially the range of how long the wait is. So from so many minutes to so many minutes, or from 1 hour to 2 hours, whatever the wait may be. And this way they know that their wait is likely to be in between those two waiting times. One of the things that we have found is now that we have these patients waiting, we essentially have a captive audience. So this is a great opportunity for us to give health promotion advice, to promote services that are offered to the patients. And what we are hoping also is to improve the patient experience, to orientate them as to what the wait is, what to ask for before they get discharged. So this is only the beginning of a much better service that will be coming through the emergency department.
Call Anna Herntier.
2 years ago, we redeveloped the Seven Oaks Emergency Department, and our focus at the time was to make sure that it was patient-friendly, particularly for the majority of our patients who are elderly. So we wanted a fairly quiet environment, and one of the things that we wanted to get rid of was a lot of the overhead screaming, really, that was taking place in a lot of emergency departments. So we came upon a technology called Vocera, and these are actually basically tools that we use in our trade to make sure that we can communicate with each other anywhere, anytime. One of the things that it allowed us to do was actually to get rid of a central desk and bring the nursing staff to the patient so that they would nurse the patient instead of nursing the chart. What this meant is that now they could get hold of the physician anywhere, and as it was a hands-free technology, the physician might have been suturing or seeing another patient and be able to respond immediately to their needs. This has allowed us to function not only more effectively, but a lot more around the patient's needs. We are able to hold conversations, we are able to have little group meetings, all by using Vocera. At the same time, we can also link this to the phone system, so I can make a phone call from my system to somebody else and receive phone calls through my system as well.